So the difference between Brainspotting and talk therapy is that talk therapy keeps you in your thinking part of the brain, whereas Brainspotting helps you, Brainspotting bypasses that and gets into subcortical processing, which allows access to lost pieces of the experience, and helps clients integrate that. So the way that their body felt, the way that they were feeling emotionally, versus maybe in some cases that would be like a case of dissociation where the client is aware or might be aware cognitively, but they don't have access to the emotion or the way that their body felt. And so it helps clients integrate all that. My name's Aimee Solis. I'm the founder and executive director of Mindful Springs Counseling. I've been practicing in Colorado Springs for the last 10 years. Before that, I was practicing in Chicago before we moved out here for personal reasons. I have a master's degree in counseling psychology from Northwestern University. And then my clinical passion, and part of why I'm here, is to talk about Brainspotting. So that's my clinical passion, and my clinical work is definitely really important and valuable to me as a professional.
Yeah, and I would guess that most of my audience doesn't even know what Brainspotting is unless they saw my documentary where on one of the days we were doing Brainspotting, but it was literally like 30 seconds of an hour and 20-minute documentary.
Yeah.
So people are probably really curious about what Brainspotting is.
Yeah, I think it doesn't get as much, it's not as known as I think it should be, because it's so effective and efficient as a therapeutic intervention, which is part of why I'm here. When you asked and reached out if I would talk about Brainspotting, I want people to know about it because I really believe in its usefulness as a therapeutic model. So what is it, I think was your question.
Yeah.
So it is a psychotherapy intervention that's mindfulness-based. It's brain-based, but it has the ability to work on the brain, the body, and the spirit or the psyche, and do all of that. And so I've had people ask if it's somatic. It's kind of all the things, or has the opportunity to be, depending on how deep the client is able to go in any given session.
Yeah.
And then a little bit more about how it looks, because that's really general, is one of the things that the founder, David Grand, talks about is where you look, how it affects how you feel. So even noticing, like, as I'm trying to talk to you and explain it, I pick different points in the room. Sometimes those different points, learning more about this has helped me learn about myself, that if I look at a different place, that might help me focus in on what I'm trying to say or how I'm trying to explain it. That's a good segue into talking about how different material gets stored in different parts of our brain, and the visual field can give access to those different parts. So when we're talking about trauma, if a traumatic experience is stored in a client's brain, we can use the visual field and find a place in that visual field where the client has access to that. And by holding onto that spot and using some focused mindfulness, the client is able to access that, and it kind of like holds that file open for the client to be able to process to resolution.
And I am by no means an expert, but I've taken that first level course, and the thing that I like the most about it as a nurse practitioner is more of the assessment piece, whereas, it's sometimes compared to EMDR, where there's not as much of an assessment piece, where in Brainspotting you're actually watching the tracking of someone's eyes, and you're choosing the location to treat. Can you better explain that? Because again, mine was this first level.
Yeah, so there's so many different ways to what's called the setup in Brainspotting. There's so many different ways to set up. that brain spotting experience for the client in a session. I think you're talking about outside window where the practitioner, the brain spotting practitioner, is holding the wand and looking for the client's, oh gosh, I forgot what it's called. The reactions, that's not the word I'm looking for. It's a different word that we use in brain spotting, but
like a slight nystagmus, like a slight movement of the eye.
A response in the client, and it can be very subtle, like a wobbling in the eyes, or a body reaction, a twitch, or it can be not so subtle, like it can be a significant movement that you're looking for. So that would be outside window, where the practitioner is looking for those responses in the client in certain eye positions, and then choosing to stop and process in those places. And then we've got the two big ones, which are outside window and inside window, where the client is themselves reporting, like, I feel it's right there, stop right there, I feel the activation there. And they're reporting to the therapist where they feel it.
And do you go in with a specific intention?
Specific intention?
Yeah. Like a specific trauma that or do you wait to see what comes up?
So the way I work with clients in brain spotting is we always kind of just check in so that we're not, like helping the client feel comfortable and adjusted to the session. And then I ask, what do you want to work on? Do you want to do brain spotting today? What do you want to work on? Sometimes during the check-in, the clients are going into this and this happened, and and that's when I bring up, hey, do you want to brain spot that? Do you want to process that? So it depends on the client and that's the beauty of brain spotting, is that it's so attuned to the client. You, as a practitioner, learn to go with the client and say, hey, do you want to process that? Or clients who more come in and are like ready to go, and I come with this agenda. Okay, let's go with that. So it just depends on what the client has.
And tell us a little bit about yourself personally, like your why. Why did you go to school to be a counselor?
So why did I go to school to be a counselor? That's a big why. I don't really have a concise response to that. When you told me you were going to ask me that, I was like, oh, that's the big question. Probably initially because we all have our stuff, and so I think we're all trying to figure that out, which is also something I love about brain spotting, is that it believes that we're all just, the brain is constantly trying to figure stuff out. So if kind of in that same way, I think I was trying to figure it out, and I didn't have enough tools available in my life at that time to make sense of it, and so I was constantly drawn towards psychology. I had other aspirations as well, but psychology kind of won. I think I really wanted to figure it out, and had my own trauma and my own stuff from childhood when I had mentally ill parents and who struggled with depression, anxiety, bipolar disorder, a lack of stability in my own life because of all that, and some other things, poverty and other struggles. And so I was trying to find a sense of stability and make sense of it for myself. Would you
identify those things by themselves as trauma, or was there abuse and neglect and what we might call big T trauma?
Yeah, because of all that, there's also big T trauma. Okay. And so I had started some form of counseling or therapy probably when I was about 18. It wasn't common. It just wasn't a thing in my family growing up. And so once I turned 18, I started seeking out services. But nothing was really working. It just didn't it wasn't sticking, and something that doesn't necessarily come from brain spotting, but this comes from my own experience healing and helping others as a counselor as well, is that I kind of felt like, and still do feel like, I and others who kind of spin our wheels in talk therapy or more traditional forms of therapy are like white knuckling through life, trying so hard to do everything right and learn all the skills. Like DBT, which there's a place for all those things. I'm not
absolutely.
knocking anything. DBT, CBT, like do everything right, follow all the steps. And it's exhausting.
Well, and it's exhausting to just try to change those neural pathways without an actual intervention to do it. I mean, you can with positive talk, change those neural pathways, but it's exhausting. It's like you're fighting against this very rigid, especially when it started in childhood, right? A very rigid neural pathway. So tell us how brain spotting softens that or makes that process easier.
Yeah. When you're in talk therapy, you're accessing that prefrontal cortex, the neocortex, the thinking part of the brain. And that's why people are kind of going over the same things or come in with the same themes, and they're spinning their wheels. They're going over and over and over it. And not much is changing, or they make little changes over a long period of time. It's just such gradual, subtle change. With brain spotting, the goal is to bypass the thinking part of the brain, get into the subcortical areas of the brain, so that you're processing from the bottom up. So that's talked about a lot in therapy and psychology, this bottom up versus top down. But for clients who what does that actually mean? So the difference between brain spotting and talk therapy is that talk therapy keeps you in your thinking part of the brain, whereas brain spotting helps you, brain spotting bypasses that and gets into the subcortical processing, which allows access to lost pieces of the experience, and helps clients integrate that. So the way that their body felt, the way that they were feeling emotionally, versus maybe in some cases, that would be like a case of dissociation where the client is aware or might be aware cognitively, but they don't have access to the emotion or the way that their body felt. And so it helps clients integrate all that. And then, could you ask that last question again?
Well, I love the word integrate. And I think people try to do that in talk therapy, but it can end up being what we call rumination, like you're just, talking about it, and then you're reinforcing that negative neural pathway that trauma created. Whereas, with brain spotting, my understanding is that integration, for me, it felt more like separation, but maybe because my emotion was so intense. But, being able to process that, I talk about processing trauma and moving it out of the body rather than holding on to it. And for me, as a consumer of it and a professional, just having some basic knowledge, it felt like a very practical way to treat trauma. Tell us a little bit about that as far as, it's treatment for trauma and what you would expect.
Did you want me to touch on the intensity?
Yeah.
Okay. So for some clients, the way that they experience trauma is by separating. Some feel flooded by it and overwhelmed by it. Some, even when they're dissociated, when they do reconnect with it, it's flooding, and usually that's the case. Like, I'm afraid to feel that, or I'm afraid to experience that. And so there's different setups in brain spotting that allow clients to connect with the trauma or to process it in a way that doesn't feel as overwhelming and scary. And the goal in brain spotting is to achieve or get to a place of regulation or brain coherence, which Daniel Siegel talks a lot about. And before Brainspotting, and he still is one of my favorite therapists and psychologists, that he talks about the brain and how there's states of rigidity and chaos, and that the regulation is that flow, like kind of that in-between place. And so that's really Brainspotting's goal, is to get people to come to that.
And so many patients really feel like they cannot regulate. And being a predominantly medical practice, even though we do counseling, you know, it sometimes feels like the client is, well, just give me more meds, give me more meds. And, you know, of course, we believe in meds, we prescribe meds, but I'm also trying to empower people that we can learn to regulate our brains. And sometimes, you know, we need medication to help us in that process, but really, you know, learning to regulate our brain. And, you know, it sounds like Brainspotting actually teaches us how to do that. And I also like the passive nature of it. I've never done myself EMDR, but I've had lots of clients doing EMDR, and it seems like a much more active participation, willing to re-experience the trauma. And for some people, that's actually not even safe. But you talked a little bit about the difference between EMDR and Brainspotting.
Yeah, so I myself was an EMDR client for a while, and I still haven't figured out quite why, but it wasn't effective for me as it is for other people. So that was really disappointing and a really tough time in my life. It was like, here's this other super exciting, you know, thing, and I finally got a chance to experience it, and I've heard it's like the thing, you know, that if nothing else works for you this well, and to feel let down again, and this is how our clients feel when they're going through years and years of therapy, like, I'm the problem, nothing is working for me. And so it was another experience where that kind of reinforced for me, like, no matter how hard I try, no matter how hard I'm working, nothing's going to work for me. So as a client, I had tried it, and then later on, a few years later, actually, after I left that EMDR experience, I got trained in Brainspotting. So having done both and having experienced, not just done as a practitioner because I'm not EMDR trained, but then having experienced both, the major difference that we can see not in the technicality of it, which I'll get to in a second, but in the experience of it, is that EMDR is pretty structured. There's a protocol, you have to follow this process, and generally you process things in order, timeline order of your life, chronological order, versus versus Brainspotting, which is very open, fluid, and flexible, and follows the client. And I think that is why my brain doesn't work in a
rigid.
It just wasn't. I couldn't do that. I couldn't process it like that, which is interesting, because if you tell a client to come in and you take their trauma history, and if a client has developmental trauma or early trauma, and you say, we're going to start processing these very early traumas, for a lot of clients that is really overwhelming, and they'll go into a freeze or not be able to do it, which is where I found myself a lot in my own childhood trauma. I would be frozen and my muscles would be locked in place, and it just wasn't working. And with Brainspotting, we trust the client to just come in with wherever they need to start, which is the beauty of it, and that's also the beauty of how the brain works. They're giving you that in. So I use this example a lot because this happens all the time with my clients. They'll come in and they'll say, I had a fight with my partner, and they're, you know, upset and devastated about it. And so that's my in, like, that's where we start. And sometimes it really is just about that fight, and we process that pretty quickly and effectively, and they go back to their lives and they work that out in the way that it needs to. And sometimes that is their in for attachment wounding and developmental trauma. And in that session or future sessions, we're able to get to that deeper place. Versus with a process and a protocol starting at the place where they don't really have that in, like their brain and them as a person, they're not open to that yet.
I definitely see a huge benefit of brain spotting in therapeutic sessions, even if you're doing other modalities. And like you said, you're doing a little bit of talk therapy, and then something comes up and you're like, do you want to,
would you like to process that? Yeah.
Would you like to process that? I would love for my therapists, my counselors to be able to have that. We have a different model here. They're unlicensed counselors under the direction of nurse practitioners. And so I've been like reluctant unless I had like somebody who could train and supervise them. Are you doing anything like that, training and supervising people?
I'm not. I think it could be in my future, but I just had my 4th baby, and so I have a really strong connection to the Brainspotting community, and there's always these opportunities to do intensives and additional training, and I've done a couple, I've been an assistant for a couple of trainings, and that's been great, but there's a longing to do that, but it's just not the right time in my life.
Not right time. Yeah, so you just had your 4th child, so you're in full mommy mode.
Yes, it's super busy.
And running a therapy center.
Yes.
How many counselors do you guys have?
I have lost count, but I think we're around 28 right now.
Okay.
Somewhere.
Are you looking for another location? We have some space upstairs. We'd love for you to.
Maybe, yeah.
Okay, yeah.
We'll check
I
it
would
out.
love to get professionals that are their own business, but in the same building, so that the referral process and the relationship process is just better for the client.
Right.
And stuff. Do you have multiple locations already?
We do. We have 2 locations in Colorado Springs and then 1 in Seattle.
Okay.
And
why Seattle? Do you have family there? Or?
I don't know. So one of our staff who is in the Colorado Springs office was moving out, and we started chatting about it, and it just seemed like a good opportunity for both of us. So she's kind of like launching and been in that space, and we're looking to hire another 1 or 2 therapists in the next year.
Does everybody do brain spotting?
Not everybody, but we have about a 70% brain spotting trained rate. So a
That's
lot.
Good.
And then we also specialize in CAP, so ketamine-assisted psychotherapy.
And who's doing your prescriptions for that?
We don't have anyone yet, but we're hoping to get somebody trained soon. Well, who we are using right now is Journey Clinical. And they're doing the oral prescriptions for CAP, but I'm hoping to get somebody like on site and with us soon.
Oh, okay.
To do that, and then our other specialties are perinatal mental health. So that's something that I came over here with. That was near and dear to me because when we moved out here, I had like a 6-month-old at the time, and so I was brand new mom, first baby. And as soon as you get pregnant, you attract all the other pregnant moms who are like, you get it. So I had started working with pregnant and postpartum moms pretty early on. And then our other specialty area is eating disorders. So we've got kind of those 4 core areas that we work in, and we attract a lot of therapists who are either experienced in those areas or want to be experienced and be around other professionals.
Yeah. So we need to get you on the referral list and make sure our counselors know about you guys. Would love to have you in the building for sure.
Yeah.
And we also are looking at possible relationships with counselors that want to do the ketamine-assisted therapy,
nice.
where we're doing the script for the ketamine and stuff.
Cool,
we do I Am Ketamine here in Spravato.
I heard about the I Am,
Yeah.
I'd love to hear more about that too.
Sometimes it's nice to combine that. So yeah, we'll definitely, talk once you're back in business mode.
Yeah.
Because,
I'm always in business mode.
Okay.
part of why I'm here today. But yeah,
Yeah.
I'm always in business mode. I'm always in mom mode. It's hard to separate them.
Right.
But bringing this up, they're not, brain spotting and ketamine are not related. So what's really interesting is that I myself I've experienced both. I experienced ketamine because I wanted to understand if this was something that I wanted to get involved in, and that if I could stand behind and offer to our clients. So I had a ketamine infusion a while back, and before I started training in it, and what I kept saying to the nurse practitioner who was doing my infusion was like, oh my God, this is like a really intense brain spotting. So,
Interesting.
yeah, I think...
Have you ever combined the two?
Yes, they work really well together.
Oh, wow. Tell me an example of a case where you combined.
So, similar to ketamine, brain spotting helps clients access things that they might not be able to in other traditional forms of therapy, for some of the reasons that we've already talked about. Like, it helps bypass that thinking brain and helps soften some of those defenses. And that is how ketamine also works. It softens some defenses. It depends on the dose, but it can really remove some defenses at higher doses, or with the type of ketamine therapy that we do, it can soften some of those defenses and open clients up. So it's like they're getting this double dose of intervention that really can help them open up and address things that they otherwise might have not been able to. And for some clients, some clients don't encounter many barriers, if any at all, in brain spotting. Whereas some with some really significant trauma and very strong defenses, even in brain spotting, they're going to encounter barriers. And so adding ketamine and combining the two really helps clients overcome those barriers and defenses.
Yeah. I have a client I want to send to you already. But let's show our clients, our listeners, what brain spotting looks like, what they might expect. I don't know how I should sit.
Yeah, can we turn? It's best to face each other.
The camera's still okay? Okay.
So this is the brain spotting pointer. And does this feel like an okay distance, or do you want me closer or further away?
Maybe closer.
Closer.
It does feel a little far. Yeah.
So that can be really important for clients, if especially when there's any attachment stuff, to determine what feels right in terms of proximity. So just checking in with you. Before we usually get out the pointer, I just wanted to show the pointer. This is where we check in, and what would you like to work on today?
Well, I was telling you, my husband passed away April 14th. He was on hospice, so there was a lot of anticipatory grief. I've lost 3 children over the last 17 years, so I understand grief and trauma. But this feels very different and maybe more separated, whereas the death of the children was clearly this trauma. And then I'm in this position right now where I don't know what I'm supposed to feel, or I'm not in touch with it, which is unusual for me. I'm usually very insightful and in touch with kind of how I'm feeling about something and how to process it.
Yeah. Okay.
Yeah.
I'm so sorry for your loss.
Thank you.
Right there. I'm sure you hear that a lot. It's a lot of grief that you've experienced in your life. So we're going to, because you said you're not in touch with it, what I'd like to try is helping you process and kind of doing this demonstration from a resource spot.
Okay.
So rather than seeking out where and finding the eye position where you feel most activated, I'd like to move the pointer and help you find an eye position where you feel the most calm, grounded, or neutral.
Oh, okay.
And then go from there.
Okay.
Which might seem strange for, you want to connect to this, but yeah. So I'll actually start as far as
And I keep my head straight and just move my eyes, correct?
It's up to you, whatever feels right.
Right around here has been the most calm so far.
Would you like to check the other
Yeah,
side?
probably.
Okay.
Yeah. That's a little activating.
Yeah. Okay, so let's,
Yeah.
I'm gonna move this up and, or actually, I'm gonna pull this back slowly and you just tell me when to stop when we get this space.
Yeah, right about there.
And then I'm gonna move up and just notice if that feels more or less.
Less calming.
Less calming, more activating, and down.
Oh, I had to move. Sorry.
So,
So what does that mean when I, probably more activating because I couldn't hold it.
so about
Almost
eye level?
uncomfortable, yeah.
About eye level here.
Mm-hmm.
Okay. And where do you feel that place in your body, the most calm, grounded, or neutral?
In my chest,
Okay.
yeah.
And so you're just going to hold this eye position and just notice. And I'm right here with you.
I don't want to go take a nap after this.
Brainspotting can be really exhausting. Your brain's doing a lot of hard work.
I'm trying to regulate my breathing, but it's...
Yeah. Just notice that response, and see where it goes. What do you notice?
Seriously want to take a nap. So I've never done this technique. The other time was like trying to find activation. So I would like cry, and then, you know, kind of calm down. Yeah, it just is a little tiring, like, which I can't take a nap. I have another interview after, but yeah, I mean, I feel calm, for sure.
Notice that experience. I can't take a nap. I've got another interview after. Just another experience, or another piece of your experience of grief. See where that goes.
Can't stop, won't stop. I mean, it's my, those are my decisions. But I prefer to be productive.
You're doing great.
I think that's one of the things that type A productive people struggle with, is like, if I find peace or calm, I won't be productive.
Yeah. I hear you. If I find peace or calm, it won't be productive. How's your breathing? You mentioned that early on.
It's getting better.
One thing to keep in mind is that though we started at the most calm, grounded, or neutral resource place, it doesn't mean that you're supposed to be calm, grounded, or neutral. So you're still processing. You get to
It's
be...
really more processing that productivity versus rest concept.
Yeah.
Is what's processing, yeah. How do you know when someone's done with a point? Like, is there a indication for you?
Usually, so what we would do is we'd assess the activation. We go back to the original issue. So let's do that.
Okay.
The original issue was processing the grief that you're feeling and it feeling different than other grief you've experienced. You've had a lot of loss in your life, but this one feels different and you're not sure. Was it that you said you're not sure if you're not sure what you're supposed to be feeling?
Yeah, and it's almost a month, and so I feel like I should be back productive, and I've tried to get up and exercise the last 2 days, and I did not. But I did come to work. So just reminding myself that, Grace, like, I'm still tired. It's taking a physical toll. And that it's okay to rest and let my body heal from all of that. Yeah.
So I just want you to notice that. Let's continue to let it process for maybe a few more minutes if you have some time. And notice that fight between it's okay to let myself rest and I'm supposed to be productive.
Now it's going deeper, and like, my worth is attached to my productivity.
So this very real loss and trauma is calling on you to rest. But there's also another drive inside. My worth is attached to my productivity. Just see where that goes. You're doing great. It was another moment that you were able to allow.
I'm not sure what you're supposed to attach your worth to. I'm trying to think of a positive that has doesn't have to do with my productivity.
I'm worthy because...
Yeah, I mean, some of my old religious things that you say to yourself are coming up, but I don't 100% believe them, so what is your worth supposed to come from? to find it from within themselves, but it's not coming up.
It makes sense why you've worked so hard.
Mm-hmm.
Can you notice what happens when I say to you, you're worthy because you are? No justification.
Yeah, that resonates.
Where do you feel that in your body?
It's still wrapped up in my thinking.
Mm-hmm.
My throat, kind of speaking my truth. I think I talk a lot about this of like, I'm a people pleaser and I want people to like me, and sometimes that means not speaking your truth.
Mm-hmm.
And then just, I've spent the last couple of years like trying to figure out what my truth is. But I'm such an overthinker of like, worth, and but yes, I am worthy because I exist is definitely resonates.
Mm-hmm. Just notice that resonance and see where it goes. And we'll allow that to process and deepen, and then I'll check in with you in a minute or so about how you're feeling. What do you notice now?
I'm actually having a hard time focusing. I keep drifting off and then trying to go back to the intention. Not in a, nothing negative, just kind of.
Yeah. So keep trying to pull yourself back to a certain intention.
Mm. But I mean, I feel like it's processed. I just didn't know if there was like, if I'm supposed to acknowledge that, or if there's something that you see.
So if you go back,
Mm-hmm.
I'm going to put the pointer down.
Mm-hmm.
A couple of things. That's good though, because your processing was about rest, right?
Yeah.
So, what am I supposed to be feeling?
Mm-hmm.
I don't know if I'm supposed to be feeling a certain way. And
Mm-hmm.
what I saw was you really got in touch with like, I'm tired. But there's a part of me that doesn't allow myself to be tired.
Right.
Because my worth is attached to all these things.
Right.
And it, for the purpose of a demo, is a little bit risky to go into the resource spot. Especially because you're used to doing brain spotting.
Mm-hmm.
By going right to the activation, which is what most people think of if they have experience with brain spotting. It's emotional and it's charged, but oftentimes it can be more useful for a client to go to a resource spot because they can, even with brain spotting, they can get flooded.
Yeah.
Or if something is dissociated.
And what do you do practically? Like, I'm assuming you schedule your appointments on the hour. You know, what do you do practically to keep those things within the hour?
So I give myself a little buffer. I have the
Okay.
luxury of allowing myself a little bit of buffer between appointments. But if not, if you have to keep to a certain, that 1 hour time frame, which a lot of brain spotting therapists don't do.
Okay.
Unfortunately, because of, there's the, this is how brain spotting should be ideally, which is a little bit more space, maybe 2-hour sessions or 90-minute sessions. And then there's the reality of working with insurance.
Right.
And so a lot of brain spotting practitioners for that reason don't take insurance. But that's always been something that's been really important to me, is accessibility. Because me growing up, counseling and mental health was completely inaccessible.
Right.
And then as I became an adult, it was only accessible if I used insurance and the insurance we had.
And so do you take Medicaid?
We don't currently take Medicaid. We did
Okay.
we did at one point, but a couple of years ago we had to resign from we chose to resign from the panel. We didn't have to. We chose to resign from the panel because of some issues with payments and recoupments. But we do take 4 different insurances currently, and that is something that's important to me and that we're always going to.
What are the 4 insurances?
Blue Cross, Aetna, Cigna, and United.
Okay.
So we'll continue to take insurance
Mm-hmm.
to keep, and that's part of our mission, is to make these deep healing opportunities accessible.
Yeah, absolutely. Access is super important for us. I'd love to be able to send people to you guys. And what is the wait time, that kind of stuff.
So our therapists have appointments available as early as next week. Usually we're within a week. At any given time, we have in-person and online appointments. So online can often make all of these things more accessible for people, so they don't have to find childcare or drive across the state.
But you couldn't do brain spotting in a telehealth appointment.
We
could
do,
you?
yeah.
Oh.
Yes.
Oh, wow. Tell me.
Fully online.
Yeah, tell me a little bit of, why it's good and why it's, maybe some challenges with brain spotting online.
Tech are always the biggest. That's always, but you've got that challenge with talk therapy and any kind of therapy.
Right.
So tech issues, all of a sudden the mic drops or things like that can be
But
really
not
disruptive.
like the field of vision. You can get the whole field of vision with.
That can be a challenge.
Okay.
That definitely is a challenge. The client still has access to their entire field of vision, but the therapist, if they're holding the pointer, the client is limited to the screen when it comes to the pointer. But with that being said, the client still has access to their whole field of vision. So sometimes I will direct a client to look off the screen and search and scan the room.
Ah, okay. So the pointer itself is not as important as the spot.
The spot is really important.
Yeah.
So the pointer is a great tool and a great resource, but not always necessary for the actual brain spotting. And often, in fact, probably 30-40% of the time, which is a huge chunk of the time I'm doing brain spotting with my clients, they actually use a gaze spot naturally, so they go into processing when they're talking. And for my experienced clients who've done brain spotting, all I have to say is, hey, I'm noticing that you have a gaze spot. Would you like to process? And we kind of just go into it. So it's a really natural, organic unfolding when we do that.
That's fascinating. I'm very excited to send some people your way. Give us the information about your clinic again. We'll make sure the contact info is in the description below. But tell us where you are and how to get in contact with you.
So we have 2 locations in the Springs. One is our main location, which is in the Briargate neighborhood. It is at 9475 Briar Village Point. And then we have another location in Old Colorado City. and that's at 1618 West Colorado Avenue.
And that would be the closest to us, yeah.
Yeah, I kind of live in this area, so I kind of find they're equidistant. So on the west side by like the I-25-ish area, Garden of the Gods area, I think either one are fairly accessible. The further west, for sure. Yeah, the west office would be easier.
Perfect.
And then Seattle.
Yeah. That's so exciting. Thank you so much. And I'm still processing, but that was a great experience. Thank you.
Yeah, you're very welcome.
Yeah.
And that's very normal.